I'll share.
Okay, ma'am.
Okay, your time is up. You can start.
Okay. Please, ma'am, but I want to ask a question. If this is what disease we call it Charlotte tooth,
Sorry, I can't
is
get what
that
you're
the
saying.
disease we call it the Charlotte tooth, Charlotte teeth? I mean,
I'm sorry, I'm not understanding. I can you?
I'm
Are
sorry,
you
ma'am.
starting the
This,
station?
no, ma'am, no, ma'am. This cell hereditary motor neuropathy type 2. This is we call it the disease we call it Charlotte tooth.
Mary Charlotte,
No.
this is old recalls.
Charcot Mary, no, not this is not Charcot Mary. It is
No.
like
It's
Mary,
different.
but it's different.
It is Duchenne dystrophy, I think.
It is
Yeah.
written in the report. It is Duchenne muscular dystrophy, the second page.
No. DHMN it is.
I mean, it is see, the description of the disease is given to you in the second page. So even
Yes,
if you have
ma'am.
not
Yes.
heard of disease, you can attempt it. I mean, you can do it. Yeah,
Okay, ma'am. I'm sorry. Okay. Okay, I will start
no
now.
problem. Then.
Okay. Hello, I am Intisar Abdul Qadir, one of the doctors in the antenatal clinic today. May I confirm your name and age, please?
Yeah, I'm Amy. I'm 25.
Hello, Amy. Nice to meet you today.
Likewise.
Okay, I understand from your GP letter that you are coming here for a pre-pregnancy counseling. I'm all right.
Yeah. Yes.
And you have a disease called type 2 motor neuropathy.
Yes, doctor,
Do you know?
I have it.
Yeah. Do you know? Could you tell me what do you know about your condition, medical condition?
That's actually started at the age of 18, and then I had problems walking. I have to walk with crutches. So then I visited my specialist, and he then diagnosed that this was the condition.
If this is hereditary in your family, is there any one of your family have the same condition?
No, actually, no.
Okay. What are you doing for living, Emmy?
I'm not doing anything. I mean, I'm a homemaker.
Are you married, or you have a partner?
Yes, I'm married. Yeah.
Okay. Are you planning for you are planning for your first pregnancy? Okay. Do you know
Yes,
your
this is
blood
my
group?
first pregnancy. First pregnancy I'm planning for. Be positive.
B positive. Okay. And what about your husband? Is everything is okay at home? He's supportive to you?
Yes, he's very well. I mean, I'm very well supported at home.
Really? Yeah, he know about your condition and that the difficulty you suffer from it.
Yes, of course. Yes.
Okay. Are you using contraception now?
Yes, actually we use condoms, so I was thinking if we can maybe try for a pregnancy.
And what about your periods? Are your periods regular?
Yeah, my periods are regular.
And where is your last period?
10 days ago.
Okay. Are you following up with your specialist
Yeah,
regularly?
I do follow up. Yes,
When
regularly.
was your last visit for him?
Almost a year ago. After that, he has not called me as such, only if required.
I think a year ago, did you speak with him or about that you want to be pregnant?
No,
Okay. Are you receiving any drugs now for your condition, medical condition?
no,
Okay. Is there any medical condition other than that you are seeing your GP for or receiving treatment for?
no,
Do you perform any surgery before in your tummy or down below?
no, doctor.
Do you smoke?
No,
Do you drink alcohol?
no,
Do you any street drugs?
no,
Okay. Do you have any? I'm sorry to say that any blood clots in your legs before or lung or any of your family
no,
suffer
no,
from such a condition?
no,
Okay.
doctor.
Okay. If I'm sorry if I appear as a little bit intruder. Is there any difficulty in your sexual relation with your husband because of that of your condition?
Yeah, I mean, we manage, that's fine.
Okay. Thank you for sharing those information with me. And if you allow me, I wanted to examine you in front of a chaplain to measure your pulse, blood pressure, and temperature, and uh, to take a urine sample from you to detect if there is any infection in your water or that. Is that okay
Okay,
with you?
okay. Sorry?
Okay, thank you. Okay,
Yeah.
coming to your concern for which you are coming today, first I want to appreciate your concern about and that you want to be in the best shape before becoming pregnant. So you are coming for counseling today. This is really very good thing. Okay,
Yeah. Thank you, doctor. Yeah.
okay, and of course there is. There is no any objection of getting pregnant, and but we have to ensure that I'm sorry, I have a mental block. I don't know.
What is it?
I want to be
On.
sure there is no mind to get pregnant. Oh, of course, after ensuring that your blood tests are good, you are receiving you don't have any I'm sorry ma'am, but I don't know what I can't complete. Sorry, I have a mental
Okay.
block.
Okay. Have you read the entire scenario?
Yes ma'am, that she has difficulty
Okay.
in walking, and especially her lower
Mm.
limbs, and she is the use of crutches.
Mm-hmm.
Always she is in need of assistance in order to walk. Also, and to little extent
Okay.
in her upper limbs. So,
Okay.
what I wanted to tell her that there is no mind to go into to try to get pregnant, and that once she got pregnant, we will do for her all the investigation needed at booking, regarding lab investigation, regarding Down syndrome screening. Also, we ask her if she is receiving rubella vaccine or not, or she got rubella before or not, also virology screening. And we will advise her to take folic acid before pregnancy, at least for 3 months before pregnancy. And of course, if she wants to be pregnant, it is better to decrease her body weight because it is a little bit above normal. And if she try to lose weight before getting pregnant, this will be fine. And it will help her to be in a good health and shape during pregnancy. Because she is in need of crutches and has very weakness in her lower limbs, she will be immobilized most of the time, or a little mobilization. She is liable to the development of blood clotting in her legs and also in her lungs. Besides, her body mass index, which is a little bit high, this will increase her chance of getting blood clots. So if she got pregnant while the same body mass index, she will need a blood thinning agent. Since early pregnancy, since early pregnancy, she will need to use heparin. And of course, after ensuring her examination that her blood pressure is normal and everything is normal, okay, she is liable to during pregnancy to developing high blood pressure. So because of her body mass index, so we recommend her to give her aspirin after the first 3 months of pregnancy. Then we will
Okay, why are you
monitor
talking
her.
as a third person? Hello?
Yes,
You can talk to me.
yes.
I'm the role player.
I'm talking. No, I'm talking to you, ma'am, because I have suddenly got a mental block. Then, when you tell me that you read the scenario, I try to collect myself. But as if I'm
Okay.
talking to the role player, if you don't mind, ma'am.
Sorry?
I'm sorry, as if I talk to the role player. So
Yeah, so you were talking in third person. So, okay, fine. No problem.
Okay, ma'am. So I will. So I advise you, Emmy, to try to reduce your body weight before getting pregnant, because this will help you very much in passing the experience of pregnancy safely. If not, we will advise to give you to blood thinning agent from early pregnancy, as well as low dose aspirin from the first. After the first 3 months of pregnancy to go. Also, a high dose of folic acid. I advise you 5 milligrams. Also, I advise you to even before getting pregnant. And of course, you are considered a high risk pregnancy. So I advise you after pregnancy to follow up in a consultant-led unit with more frequent visits and more screening for your baby growth. Of course, at the age of 20 weeks of pregnancy, we will do an anomaly scan at the maternal unit to ensure that everything is all right about your baby. Is that okay with you,
Okay,
Emmy?
fine.
Are you following me?
Yes.
And then at the age of
Okay.
36
Okay.
weeks,
Your time is up.
I'm
By
sorry,
the way.
I have
mean,
taken a lot of
long
time, ma'am. I'm sorry. Okay.
Yes. Yes. No problem. Okay, you actually did start well and it was going well. Then suddenly you stopped. Okay. That's fine. See, even if you can't think of anything, just check. You know, the station would be attached to the table. So just see if there's something that you're missing. And this station, the station is more about the obesity, my dear. Okay, she has BMI 40. Okay,
Yeah.
you were so engrossed with this condition and you probably have not heard of it or do not know it. I mean, it is possible that they would give you something like that. So which is why you were kind of talking only about that condition, okay, because you were probably trying to think what all points you need to say, but in the bargain you forgot to address the major issue, that is the obesity, right? So you said that the PMI is slightly higher, but it is not slightly higher, she is obese. 40, she's
Yes,
40,
yes, ma'am.
PMI
I
is
know
40.
that she is morbidly obese, but they advise us before not
So
to
there are,
say that you are in a high, just to say sensitively that she is a little bit higher than, not to say it like that
no,
you
no,
are.
you cannot say a little bit higher. You can say your weight for height is higher, because if you say a little bit higher, the examiner will interpret that probably you do not know the classification of obesity. So you cannot say it's little bit higher. You just say that it is high. Don't add adjectives or I mean, to the sentences. You just say that it is your, since your weight for, and don't say BMI, your weight for height. Weight for height is high. Okay. So there are certain risks, and there are a lot of things that you need to say. You did manage to say cover it later. You mentioned a few things later. Okay. So
Okay,
in
ma'am.
fact, only obesity itself can come as a station without the other associated condition. So you can have a station that has only obesity in it. Okay, and there is a
Okay,
lot to
ma'am.
talk about obesity. Because remember, there is a guideline in obesity. Yeah. So
Yes, ma'am.
okay, so we'll go through the key here. Okay.
But I talk about her
Yes.
body mass, and
Sorry.
I tell her to better to reduce weight before pregnancy, and if got pregnant, she
Yes.
has to take
Yes.
extra.
Yeah,
Okay.
all of that, and there are a lot of things to add to in obesity as well. So
Okay, ma'am.
so to start with, you can start with your introduction and any concerns, and set the agenda. You say that you have gone through your GP letter, and you need not say that I believe you are having this condition. You just say I've gone through your GP letter. Tell me more about your condition. Okay, just say it that way, so that will help you. I mean, it will kind of let the role, when you are putting the ball in the role player's court, so the role player can talk whatever she has to talk, whatever is provided to her in the script. So put an open question always in a maternal medicine station. It helps, because then if you ask a specific thing, then you have to ask a few more questions to get the relevant information from the role player. So once you have done, you're done with your introduction, your setting of agenda, you have said that you have gone through the GP letter. You say, can you tell me more about it? Then she will tell you that this is the condition and I am not able to walk. Then you need to show a bit of empathy. So that will be marked under communication with patient. Okay, the moment a patient says something is wrong with her, or something, or she is complaining about something, you would have to show empathy in the station. Okay, you say that I can see that you are going through a lot, and I will try my best to help you with this. Okay, something like that you can say in the station to her. All right. Then
Okay, ma'am.
after that, yeah, if she doesn't say, if when you put an open question, she doesn't tell you the information that you require, then you can ask a few specific questions depending on what she has already told you. Like, are you having any difficulty getting by, or do you have frequent falls, or any weakness in any other part of your body? She's told you that she's not able to walk, so ask about, see, you have to ask about the condition. See, it is on motor neuron neuropathy. So in motor neuropathy, what is going to happen? She's not going to be able to move her peripheral muscles. So ask her whether she's having any weakness in the upper limbs, or it's just the lower limbs. Okay, whether she has frequent falls. Okay, and what is she? How has she visited her? All those things you did ask, that is fine. And what is her occupation? Okay, that I think you asked. Okay, then you go to the rest of the history quickly, and then come to the major part of the discussion. Now the station has to be discussed in uh, as far as this condition is concerned, and for obesity also. Okay, so now you know that this condition is autosomal dominant. Okay, So there is a possibility that it can be inherited. Okay, she said that she doesn't have family history, but that is also possible because she could be having a mutation for this condition. Okay, so it is also likely, it is possible, it is not something that doesn't happen. It can happen that she's having an autosomal dominant condition, but she doesn't have a family history because she has a mutation of the gene resulting in a dominant trait. Okay, but this trait she can transmit to the baby. Okay, you have to tell her that there is a 50% chance that this particular condition can be transmitted to the baby, and that is if the partner is normal. Okay, and in such a case we can check for that by going ahead with a test tube baby and doing a diagnosis of the conditions prior to implantation of the pregnancy. Or if you do get pregnant, then we can offer you the needle test in order to check if this particular condition is affecting the baby. But now you know that this patient is also obese, so you would also have to say that performing a scan and the needle test may be difficult in her because her weight for height is more. Okay, so this is how you relate things given to you in the station. Okay, then that is about the condition. And other things is like mobilizing. So she may have difficulty in mobilizing, and that can sometimes worsen in pregnancy. And she may develop, as a result of that, there may be a possibility of increased risk of she developing blood clots in her lower limbs. So that is the effect of this disease on her pregnancy. Then you have to discuss about the obesity. So you say, since the weight for height is more, usually patients may have a straightforward pregnancy, but there are certain risks associated. What are the risks? You have to talk about in terms of effects of the condition on the pregnancy and effects of the pregnancy on the condition. Okay, here there is no effect of pregnancy on the condition as such, so you have to talk about the effects that she would have by virtue of being overweight, like further difficulty in mobilizing. Okay, there can be increased pain in the muscle and joint. Now considering this particular condition, that she's having this problem already, okay, plus obesity, she can have these problems. Okay, she's come to you preconceptional, so there can be difficulty conceiving. What can happen in the preconception period? She can have difficulty conceiving. She can have, even if she gets pregnant, there is a higher chance that she could have a miscarriage, high blood pressure, diabetes, clots, etc. Okay, so all these things you need to mention to her. Okay, then the baby may have certain problems, like the baby may inherit this trait, or baby can have abnormalities. Okay, then prematurity, or sometimes a big baby. Okay, and then maybe difficulty to perform a detailed ultrasound for the baby. Okay, as you mentioned already over there. Then as far as the labor, so this is how you go in a maternal medicine station. Discuss the condition in brief. Okay, discuss what can happen on the effect of the condition on the pregnancy, effect of the pregnancy on the condition. Okay, then you discuss about her treatment or the management. Okay, so first, as of now, what is the management? That she would need to lose weight. Okay, and so for that we can get you help by referring you to the dietitian, to the physiotherapist for exercises, etc. Your pregnancy care also would be in a multidisciplinary setting. Okay, which would involve the anesthetist, the specialist, the physiotherapist. Okay, all of these. Okay, then offer high dose. Now she's obese, so high dose of folic acid for her. You need to tell her that she has to take it at least 1 month prior to the pregnancy and then continue it through the pregnancy. What are the other things that you would do in pregnancy? Is basically, you would need to offer her blood thinners. You would need to use a correct size of BP cuff. Okay, and ensure that other equipments are also available that may be required, special equipments that may be required for her care in the pregnancy. These are the points that are mentioned in the guideline, if you remember. Okay, so you have to say these things. Okay, then monitoring by a consultant consultant care. Okay, I mean the pregnancy antenatal care would be in a consultant level, and she would be offered routine scans. She would be offered monitoring for the baby's growth. She would be offered sugar test, okay, at 24 weeks in pregnancy because of the risk of diabetes. Okay, so what you need to do, what you need to understand is you mention all the risks first, then you mention what are the things that you are going to do, okay, in taking into account the risks that she's already having. Okay, so that is what you are expected to do in a maternal medicine station. So in this case, as far as the condition is concerned, the neuropathy is concerned, you need to explain that there is a risk of inheritance, there is a risk of difficulty mobilizing, increased pain, and DVT. The rest of the station will be about obesity. Okay, a little bit about labor also you would have to tell her, okay, as in any other maternal medicine, but you organize it in this manner. If you do organize it, it will smoothly flow the station. Okay, things that you would do in labor would be that she may require early delivery, she may require induction, okay, that is she may have to be offered medications to get her into labor. Okay, she may require insertion of an IV cannula earlier, okay, early epidural. Okay, she would be monitored continuously in labor, and there is a risk of bleeding in labor, which is why she would be offered medications to control the bleeding. So in one sentence, mention about labor. In one sentence, mention about the complications in pregnancy. Okay, followed by the management. Okay, after delivery, she would be offered support for breastfeeding. This is an important point because there is problems with breastfeeding in obese individuals. She would be offered blood thinners and early mobilization. Okay.
Yes, ma'am.
Then you have to say
Thank you.
about PIL, support groups, and documentation. These are the things that are important. As I mentioned earlier, point on PIL you can say earlier in the station, so that so as to be on the safer side, particularly in a maternal medicine station. Is that clear?
Yes, ma'am. Thank you.
Yeah. Okay.
Sorry about
so
being
this
disturbed. Sorry.
That's perfectly fine. See, this kind of stations, something that can scare you totally can be easily you can get in the exam. But what you need to remember is that, see, what is expected of an ST5 is not expected to know all these hi-fi syndromes or genetic problems. It would be provided to you. The condition is mentioned in the GP letter in this station. Okay, so the things that are likely to happen, you would have to interpret from what is given into you in the GP letter. The complications likely to happen in pregnancy, you would know from what is described about the condition to you. Okay, you have to take into account the entire picture. She's obese, so you have to discuss that. All right, and how obesity and the condition can be linked, you need to think about that. One is that the mobilization is a problem. There may be pains in the muscles and joint pain, and even if the diagnosis of the condition needs to be done by offering a prenatal, that is a needle test, then that may be difficult. Okay, so these are the things, and ultrasound may be difficult, okay, for the fetal medicine specialist. So these are the things that are interlinked. Okay, and otherwise please just follow the template, and it is possible to finish it in 10 minutes, even in 9 minutes. All right. So
Okay, ma'am. But is this could happen in the exam, ma'am? All of a sudden, I lost my concentration, and I have no words to talk, as if I have nothing to say.
you just see, you have to believe in yourself, and you know that, see, I knew that you know the concept. I mean, you know about it. Okay, so you have to have that faith in yourself, be confident, and practice more, so that in the exam that doesn't happen. Once you have practiced enough, and you think you have practiced enough, it is less likely to happen in the exam. Okay, and have faith in yourself. You know the subject. It is not like you do not know. You know it. Okay, and it was very clear that you knew your subject well.
Thank you, ma'am. Thank you
Yeah? Yeah,
for your thank you for your support. Thank you.
no problem. You're welcome. Okay. Any questions there? Hello?
Yes, Dr. Ankita.
Hmm?
Can I ask one thing?
Sorry?
Yes. Can I ask something?
Tell me. Yeah,
Yeah,
sure, sure.
yeah. You explained that in pregnancy that we can offer her for needle test uh, or scan will be difficult. But before pregnancy, pre-pregnancy for autosomal dominant, can we offer her that for as a, that one pre-implant genetic diagnosis?
Yeah, I said that, no? I said that there is an option of test tube baby with possibility of diagnosing this condition before implanting.
Yeah. So pre-implant genetic. What about the cell-free? If patient is mm, uh, want to know more about the cell-free.
Cell-free fetal, yeah, cell-free fetal DNA is available only for specific conditions, not all.
Uh, okay.
So, and it is not on NHS.
Yeah.
Secondly,
It.
okay,
Yeah.
but
It is not. It is.
so
Yeah.
cell-free fetal DNA, there are only specific things that it can detect.
Okay. Okay. Thank you.
Ma'am, I have one question. Like in a BMI of 40 and she's having this genetic condition, should we not offer her contraception and advise her for weight reduction before embarking onto pregnancy?
Yes, yes, I think I mentioned it. Yeah, you need to advise her before embarking on pregnancy. Even she mentioned it. You need to advise her weight reduction. Yes, that is actually a safety point. Okay, that is what they are testing you on.
Hello.
Okay,
Ma'am, what
yeah.
contraception should we advise her? In intrauterine
You,
contraceptive devices and progesterone
yeah,
only.
progesterone only. You can advise, yeah. It won't be safe to
Ma'am,
advise estrogen containing contraception. Yeah.
sorry, one question. Can offer her bariatric surgery as she is 40 kg?
You can, but then, I mean, the first thing you would offer her right now would be reduction of weight if she has not followed it earlier with dietitian and physiotherapy referral. That would be the first thing that you would say. If that doesn't work, then you can offer. If she is infertile, then she can offer. See, BMI more than 40, I know, is one of the indications for surgery. But I mean, before saying diet and exercise, I don't think it is safe for you to directly say bariatric surgery, because bariatric surgery by in itself has a lot of problems associated. Okay, so you go
Okay,
stepwise. You say first diet, exercise, and then when.
okay, thank you.
And Dr. Ankita.
Yeah. Hello. Hello. Hello.
Dr. Ankita, can you hear me?
Yeah, I can hear you now.
Okay, so I was just asking because her the thing of exercise would be limited. So definitely the bariatric surgery should come later. But can we also
Yeah.
do we also need to tell her that okay, we know that your exercise capacity would be limited, and we can have a low threshold for going to bariatric surgery.
You have a low threshold, definitely. But see, this is a station where you basically see, you have to understand that the exam is a tick box exercise. So you
Yeah,
have to
to go for lifestyle first.
make sure that you tick all the. See, if this session was over 20 minutes, then maybe you can go into the details of that. Here you have to
Yeah,
touch
correct.
upon the various points. You have in the key what is provided is diet, exercise, bariatric surgery. So if you just mention it, then that would be enough.
Actually.
You need not go into so much details of it, because there are other points that you need to cover.
Correct. Okay. Thank you.
Yeah, welcome.